Now I'll be discussing the second cervical vertebrae, which is an atypical variety and is known as the axis. The word axis comes from the Latin word axle, meaning pole. It is named so because the atlantoaxial joint provides the rotational movement of the neck, and this serves as the axis of rotation. One thing that will help you identify this vertebrae is the tooth-shaped process called dens. I'll tell you how it is formed. It's the body of the atlas and body of the axis fused together, which forms this elongated, pillar-like structure. There are four surfaces: superior, inferior, anterior, and posterior. I'll be discussing these surfaces in detail. The superior surface is fused with the dens, which articulates with the posterior surface of the anterior arch of the atlas, and posteriorly with the transverse ligament of the atlas. The inferior surface is articulating with the lower vertebrae. The anterior surface is presenting a median ridge with hollowed margins on each side. The pedicles are concealed by the large superior articular facets. The lamina are strong and thick. The superior articular facet is large, flat, and circular in appearance and overhangs the foramen transversarium. Each inferior articular facet is lying in the downward and the forward direction and articulates with the third cervical vertebrae. The transverse processes are small in size and represented by the posterior tubercles. The spine is bifid, terminating in two strong tubercles, but thick and strong. Now, there are a lot of muscle attachments that you have to remember, but we'll make things simplified for you. The dens is providing attachment at its apex to the apical ligaments and bilaterally to the alar ligaments. Anteriorly on the body are the insertions of the longus colli and the anterior longitudinal ligament. The posterior surface provides attachment to the posterior longitudinal ligament, the cervical limb of the cruciate ligament, and the membrana tectoria. The lamina has the ligamentum flavum attached to it. The tubercle of the transverse processes has the attachments of levator scapulae, scalenus medius anteriorly, and the splenius cervicus posteriorly, and intertransverse muscles. You can remember these by the mnemonic slits. S stands for scalenus medius, L stands for levator scapulae, IT stands for intertransverse, and S stands for splenius cervicus. I hope that helped. Now, coming to the spine, we have another helpful mnemonic. Miss Rosie is lovely, where the M stands for multifidus, I for inferior oblique, S for semispinalis cervicus, S for spinalis cervicus, R for rectus capitis posterior, I for interspinalis, and L for ligamentum nuchae. So I hope the attachments are quite clear now. Just practice over the mnemonics and I'm sure you'll ace through your exams.